In this video, we will be covering valvular disease of the heart. As we know, the heart has four chambers. The two upper chambers are called the left and right atrium, and the two lower chambers are called the left and right ventricle. The four valves at the exit of each chamber maintain one-way continuous flow of blood through the heart to the lungs and the rest of the body. Two AV valves or atrioventricular valves, that is called mitral and tricuspid valve, and two semilunar valves, that is called aortic and pulmonic valves, control blood flow through the heart. Oxygen poor blood coming into the heart from the body flows into the right atrium. The tricuspid valve is the valve between the right atrium and the right ventricle. It opens so that the blood can be pumped from the right atrium to the right ventricle. The mitral valve lies between the left atrium and the left ventricle. It opens so the oxygen-rich blood from the left atrium can be pumped into the left ventricle. The tricuspid valve has 3 leaflets. The mitral valve has 2. Both valves have chordae tendineae that anchor the valve leaflets to the papillary muscles and the ventricular wall. The semilunar valves are located between the ventricles and their corresponding arteries. The pulmonic valve lies between the right ventricle and the pulmonary artery. The pulmonary valve controls blood flow between the right ventricle and the lungs. It opens to let the heart pumps blood out of the ventricles into the pulmonary artery towards the lungs, so it can pick up oxygen. The oxygen-rich blood flows back from the lungs into the left atrium. The aortic valve lies between the left ventricle and the aorta. The aortic valve controls blood flow from the left ventricle into the aorta, that is the main artery in the body. When this valve opens, the oxygen-rich blood is pumped to the aorta and then out to fuel the rest of the body. In between each step, the valve closes to prevent blood flow flowing backwards and mixing oxygen-poor blood with oxygen-rich blood. The one-way continuous flow of blood delivers oxygen throughout the body. The function of a normal heart valve is to maintain the forward flow of blood from the atria to the ventricle and from the ventricles to the pulmonary artery and aorta by opening and closing in response to the blood pressure changes as the heart contracts and relaxes through the cardiac cycle. Heart valve disease occurs when one or more of the heart valve do not open or close properly. When it affects more than one heart valve, it is called multiple valvular heart disease. When any of the heart valves do not close or open properly, blood flow is affected. When valves do not close completely, blood flows backward through the valve in a process called regurgitation. When valves do not open completely, a condition called stenosis, the flow of blood through the valve is reduced. Valve prolapse is when a valve slips out of the place or the valve leaflets do not close properly. Heart valve disease can be classified as mild, moderate, or severe. It can lead to an enlarged heart or heart failure. Heart failure is a serious medical condition where the heart cannot pump enough blood to meet the body's need for oxygen. Many valvular heart diseases can be treated with medications or surgery and other procedures to repair or replace the valve. Mainly 3 types of valvular heart diseases are found. They are valvular stenosis, valvular prolapse, and valvular regurgitation. Now we will see each one in detail. First one is mitral valve stenosis. Mitral valve stenosis is the progressive thickening and contracture of valve cusp with narrowing of the orifice and progressive obstruction to the blood flow. Mitral stenosis is an obstruction of a blood flowing from the left atrium to the left ventricle. In mitral valve stenosis, the valve opening narrows. Because of that, the heart now must work harder to force blood through the smaller valve openings. Blood flow between the upper left and lower left heart chambers may decrease. Now we will see the causes of mitral valve stenosis. First cause is rheumatic fever. Rheumatic fever is the most common causes of mitral valve stenosis, especially in adults. It is most often caused by rheumatic endocarditis, which progressively thickens the mitral valve leaflets and chordae tendineae. The leaflets often fuse together. Eventually, the mitral valve orifice narrows and progressively obstructs blood flow into the ventricle. When rheumatic fever damages the mitral valve, the condition is called rheumatic mitral valve disease. Symptoms may not be seen until years to decade after rheumatic fever. Next cause is calcium deposits. As the age increases, calcium deposits can build up around the mitral valve. This can cause narrowing of the structures that support the mitral valve flaps. The condition is also called mitral annular calcification or MSC for short. Severe MSC can cause mitral stenosis symptoms. It is difficult to treat even with surgery. People with calcium around the mitral valve often have similar problems with the heart's aortic valve. Next cause is radiation therapy. This is a treatment for certain types of cancer. Radiation to the chest area can sometimes cause the mitral valve to thicken and harden. The heart valve damage typically occurs 20 to 30 years after radiation therapy. Heart condition present at birth or called congenital heart defects. Rarely some babies are born with a narrower mitral valve. Other health conditions like lupus and other autoimmune conditions may rarely cause mitral valve stenosis. Now we will see the pathophysiology of mitral valve stenosis. Normally, the mitral valve opening is as wide as the diameter of 3 fingers. In cases of Marcus stenosis, the opening narrows to the width of a pencil. When stenosis occurs because of any inflammation, the left atrium has great difficulty moving blood and emptying itself through the narrow orifice into the ventricle because of the increased resistance of the narrowed orifice. Therefore, it dilates and hypertrophies because of the increased blood volume it holds. Because there is no valve to protect the pulmonary veins from the backward flow of blood from the atrium, the pulmonary circulation becomes congested. As a result, the right ventricle must contract against an abnormally high pulmonary arterial pressure and is subjected to excessive strain. As a result of the abnormally high pulmonary arterial pressure that must be maintained, the right ventricle is subjected to a pressure overload and may eventually fail. Clinical manifestations of mitral valve stenosis. Mitral valve stenosis usually worsens slowly. Patient may not have any symptoms or may have mild ones for many years. Symptoms of mitral valve stenosis can occur at any age, even during childhood. The most common and first symptom of mitral stenosis is often breathing difficulty on exertion as a result of pulmonary venous hypertension. It usually happens during physical activity and exercise, but can also happen while lying down. Patients with mitral stenosis are likely to show progressive fatigue as a result of low cardiac output. More than being tired, this describes when patients feel exhausted to the point that it interferes with their normal activities. Any infections usually cause bronchitis. If patient has mitral valve stenosis, patient may get these infections more often. Patient may have heart palpitations. This often happens when mitral valve stenosis puts more pressure on the upper left chamber of the heart, causing an irregular heart rhythm called atrial fibrillation. When the heart isn't pumping blood in its upper chambers as effectively, a clot can form because of the reduced blood flow. This clot can then travel from the heart to the brain, where it can get into a smaller blood vessels and cause a stroke. Patient may have hemoptysis, that is cough with blood, and experience repeated respiratory infections. This sometimes happens when the limited blood flow puts pressure not just on the upper chamber of the heart but also on the veins in the lungs. The patient may have hoarseness sound. One of the nerve that controls the vocal cords runs next to the heart. Increased pressure in the upper chamber of the heart can put pressure on this nerve. The voice may give out if this nerve is under enough pressure. Patient may have swelling in the abdomen, ankles, or feet. This happens when the heart is struggling to pump effectively, causing fluid to build up. Patient may have dizziness or fainting, chest discomfort, or chest pain. Mitral valve stenosis symptoms may appear or get worse when the heart rate increases, such as during exercise. Anything that puts stress on the body, including pregnancy or infection, may trigger symptoms. Children who are born with mitral stenosis often have these symptoms like trouble feeding or sweating while feeding. This symptom is one of the most common indicators of mitral valve stenosis in infants. They may have cough. This may also include wheezing or struggling to breathe. Slowed growth. This means that the child's height, weight, and other indicators are lower than expected for their age. Child may have frequent respiratory infections, shortness of breath. Shortness of breath is especially very common. It may cause older children to tire out easily when they are active. Many women who have mitral stenosis don't know it until they develop symptoms during pregnancy. This is because when patient is pregnant, patient's heart work harder to provide blood for both patient's needs and those of a fetus. What are the assessment and diagnostic findings? The pulse is very weak and often irregular because of atrial fibrillation. A low-pitched, rumbling, diastolic murmur is heard at the apex. As a result of increased blood volume and pressure, the atrium dilates, hypertrophies, and becomes electrically unstable, and the patient experiences atrial dysarrhythmias. Tests may include echocardiogram. An echocardiogram can confirm mitral stenosis. Sound waves create images of the beating heart. The test can show areas of a poor blood flow and heart wall changes. It also can help find out the severity of mitral valve stenosis. Next test is electrocardiogram. This test shows how the heart is beating. Next is chest X-ray. A chest X-ray shows the condition of the heart and lungs. It can tell whether the heart is enlarged, which can be a sign of certain types of heart valve disease. Next is exercise stress test. These tests often involve walking on a treadmill or riding a stationary bike while the heart's activity is checked. Exercise tests help show how the heart responds to physical activity and whether valve disease symptoms occur during exercise. Next test is cardiac CT. This test combines several X-ray images to make a detailed view of the heart and the heart valves. A cardiac CT is commonly done to see mitral stenosis that isn't caused by rheumatic fever. Cardiac MRI test uses magnetic fields and radio waves to create detailed images of the heart. A cardiac MRI might be done to determine the severity of mitral valve stenosis. Next test is cardiac catheterization. This test isn't often used to diagnose mitral stenosis, but it may be done when other tests aren't able to diagnose the condition or determine its severity. A flexible tube called a catheter is inserted in a vessel, usually in the groin or wrist. It is guided to the heart. Dye flows through the catheter to arteries in the heart. The dye helps the arteries show up more clearly on X-ray images and videos. Echocardiography is used to diagnose mitral stenosis. Electrocardiography and cardiac catheterization with angiography are used to determine the severity of mitral stenosis. Now we will see the management, the medical management. Medicines are used to reduce the symptoms of mitral valve stenosis. They may include antibiotics to prevent a return of rheumatic fever if that is what damaged the mitral valve. Blood thinners called anticoagulants to help prevent blood clots if patients have an irregular heartbeat called atrial fibrillation. Beta blockers, calcium channel blockers, or other heart medicines to slow the heart rate. Medicines for irregular heartbeat, antiarrhythmics drugs are given to the patient. Diuretics, also called water pills, to reduce fluid buildup in the lungs and other areas of the body. Other treatment option is surgical intervention. A diseased or damaged mitral valve might eventually need to be repaired or replaced, even if patient doesn't have a valve disease symptoms. If patient needs surgery for another heart condition, a surgeon might do mitral valve repair or replacement at the same time as that treatment. Balloon valvuloplasty is done to repair a mitral valve with a narrower opening. It is also called mitral balloon valvotomy, percutaneous mitral balloon commissurotomy, or percutaneous transvenous mitral commissurotomy. Balloon valvuloplasty uses a flexible tube called a catheter and a tiny balloon. The doctor inserts the balloon-tipped catheter into an artery, usually in the groin. It is guided to the mitral valve. The balloon is then inflated, widening the mitral valve opening. The balloon is deflated, then the catheter and the balloon are removed. Next procedure is open heart surgery to repair the valve. If a catheter procedure isn't an option, an open heart surgery called open valvotomy may be done. The surgery also may be called a surgical commissurotomy. It removes calcium deposits and other scar tissue blocking the mitral valve opening. The heart must be stopped to prevent bleeding in the chest area during this surgery. A heart-lung machine temporarily takes over the heart's jaw. The procedure may need to be repeated if mitral valve stenosis returns. Next procedure is mitral valve replacement. If the mitral valve can't be repaired, a surgery may be done to replace the damaged valve. The damaged valve is replaced with a mechanical one or a valve made from cow, pig, or human heart tissue. A valve made from animal or human tissue is called biological tissue valve. Biological tissue valve breaks down over time and may need to be replaced. People with mechanical valves need lifelong blood thinners to prevent blood clots.